All right, and 3, 2. Gabriel, thank you for coming on.
My pleasure, Rick. It's a pleasure to be here.
I want to start off right away is that we'll get into what you do. I'd asked you for what we're going to talk about, and you're a clinical psychologist. And
No, sorry,
sorry,
that I'm not a psychologist. I'm a registered clinical counselor.
But you're a registered clinical counselor.
Yeah.
And I had asked what we could cover, and I remember the conversation was through text, and what came back through text hit me when I looked at it. And you went right to the heart of the matter, and you wrote self-hate. And part of me wanted to, I felt, oh no, that's too real. No, can we not make it more gentler? And then I was like, I thought about it. I'm like, no. Self-hate's going to be perfect. That's exactly what we should get into. So let's go back to the beginning. So you are a clinical registered.
So I'm a registered clinical counselor. So I offer psychotherapy. I have a master's in clinical counseling. And then my school of thought, the one that I chose, is psychoanalysis or psychodynamic therapy. I offer there's other theories or schools of thoughts that I'm interested in. I also applied, which is attachment theory, and on a practical approach, solution focused. But basically, it's based really what I'm interested in psychoanalysis.
And why are you interested, or we're interested in that?
Right. Well, many reasons. One is that that was the theory. I'm originally from Argentina, and over there it's very common to, at some point, go to a therapist. It's a cultural thing. There's no taboo. There's no stigmatize. It's not stigmatized as it is, for example, here. People just find it as common. Actually, when you don't go to a therapist, they wonder why.
I remember you had said that before, and I had laughed because it was like someone might say, "Oh, I'll meet you after therapy," or here we say, "Yeah, I'll meet you after yoga."
Right.
Or
exactly.
the gym.
Over there, it's after therapy or before therapy. Yeah. And so psychoanalysis is actually, it's the country that has the biggest amount of psychoanalysts in the world. I think the other one is maybe France. New York is another big city but Argentina is one of the biggest. And that's where I ended up going to, a psychoanalysis. And so I did it for many years, and I understood that there is an unconscious mind. There's an unconscious part of our mind, things that I wasn't aware of, and now I am. So I understood that that's the type of approach that I was interested in once I decided I want to do that.
And through your work, you discovered that people had self-hate, or you went into it knowing that's what it was?
Well, it's one of the main, I won't say that's the thing, but it's very common when somebody approaches me for help, for therapy. They start to tell their story. I ask questions, and usually I can see that it all involves around those demands that they have on themselves. I'm not good enough. I should do better. I'm not working enough. Or they're working too much and they can't stop because they're afraid that if they do, they're going to be judged by their peers, by a supervisor, that their partners are thinking that they're not good enough, or friends, or it's so they live with those that torture voice, that inner voice. And so it's a very common theme in therapy.
And during that process of listening to them, are there certain key elements that you're listening for that it's going towards? Is there are there key words that you're picking up that you're hearing? Okay, this is where we're headed with this person.
Well, usually, yeah. Depending on what is usually people come with something. I have this problem, and it's been going on for years. They notice it doesn't go away, and it comes back and back, and that's in psychoanalysis that's called repetition compulsion. Compulsion to repeat something that comes back. It's a theme that comes back over and over. Oh, I always choose, or they don't say I choose. I always end up with the wrong partner, someone who doesn't really appreciate me, or uses me and then abandons me. It's always I never find the right individual, and so they at some point they say, well, maybe it's not them, maybe it's me. Maybe that's why they go to therapy, because they realize it's happening too often. At some point they realize maybe it's not the other one. Maybe I'm choosing the wrong people. Why am I choosing the wrong people? What makes me want to choose the wrong people? And so that's where it starts with that, but the conversation can then, and especially in the type of therapy that I offer, there's layers. We're complicated. Human beings, we're complicated. There's layers to our behavior. And that's where the unconscious mind comes in, because it's not that people wake up in the morning and say, how can I make my life more miserable? How can I complicate it and just make myself suffer? They don't do it on purpose. Something makes them be in that place.
And does that go back back to the childhood?
Most likely, yes, because life starts even before you're born. Your parents thought something about that unborn, even before, that mother, when she was a child, she was thinking, the day I'm a mother, I'm going to have this kind of in her fantasies. So life starts even before you exist, because somebody, before they had you, had something in their mind of what type of children they want or did not want. Because if you're an accident, if you you were not wanted by that mother or father, then it's not going to be the same as somebody who is born from someone who is wanted.
Wow.
Yeah.
That's really deep.
Yeah.
You went pretty far back. I didn't know you were going to go that far back.
Well, there's layers. That's when somebody comes with a problem. You start digging in, they discover, oh yeah, but it's related to something, and I remember, and I see that, and so there's more, and more things come up, if you want to. Now, there's different approaches to therapy, so you can dig a little deeper, deep psychology, they call it, psychoanalysis, or you could keep things on a superficial level and just cope, which is, some people, that's all they want. I want to cope. I don't want to go scarving into my past and conflicts and things that for me are just too painful. I don't want to go there.
But we don't make a conscious decision, do we, that we just want to cope? We just say, this is life.
Well, I don't know if it's a conscious decision. Oh. It could be a conscious decision. I want to cope. I want to, people don't say, I want to cope. They come and say, I want to feel the way I was feeling before I started feeling this way. Like I have a lot of anxiety. I have depression. I'm depressed. I don't want to get out of my bed. So those are symptoms. And some people say, I'm feeling this. It doesn't go away. Help me. And so there's different approaches to therapy.
And so that leads into the next question. And the gluttonous desire of all my self-help people out there. We just want to get the book. We want to get the 2-step book, the 3-step book. So we have the self-hate. Now the listeners, okay, well, what book can I get?
Right.
What can I do to get out there? And your answer before, because I wanted to make sure that I spoke to you before we kind of came on, is that's not the answer.
Well, I mean, it's the answer for some people. I won't. Who am I to say what's the answer? For some people it works. That's all they want. But We're complicated beings. So if it was as simple as reading a self-help book and that's it, all you have to do is follow the instructions of how to be happy in your life. First of all, that works for the author who wrote the book, maybe. And the other thing is that, yes, he tells you how to just follow certain steps, and he's thinking, I'm going to make money with this book. I'm telling people how to be happy for the rest of their lives. Okay, good luck. He's generalizing, and we're unique. Everybody's unique. Everybody's different. So when I see someone, I'm not thinking, from a theoretical, from my theory. Oh, this is who comes into my, my space, my office, and fits into this particular thing of my theory. I'm listening to that human being with their particular story, and I have to adapt myself to that story.
We used a great example last time. It's the thumbprint.
That's exactly the thumbprint is going to be unique for every person. That's why you can use it, and I don't know, do they still use that for police?
I'm pretty sure they do that, and DNA.
Okay.
I watch a lot of crime drama.
Right, okay. Yeah. Anyway, in the old days, police, that was the way to identify one person from another. We all have the print that our fingers leave are going to be, there's no one that is similar to the other one. That was discovered actually by an Argentinian. And,
yeah. Throw that in there.
Yeah. And it was used ever since, I don't know, 1800s by the police. And that's the same with our behavior, with our life. We're all unique and different.
So how does one choose a therapist?
Well, I would do a little bit of research before you decide, because there's dozens of schools of thoughts in therapy. The most popular one, CBT, cognitive behavioral therapy. The school of thought in that one is that if you change the way you think, you'll change the way you behave and feel, and they'll give you a lot of homework. What they want to do is that they help you approach that negative thought, for example, from a different perspective, and change it into maybe a positive thought, challenge that negative thought. And it works for some people, and they'll give you a lot of self-help reading material as well. And it works in the sense that now you're coping, because you're telling yourself that, for example, somebody who says, yeah, I'm not good enough. Well, you're not good enough for what? And why are you not good enough? So they want to challenge that. But that's from a conscious level. Many people that come to me say, I tried CBT and it helped, but then I had another problem, and that's it. Maybe it was a more important problem for them, or they were more critical. I don't know. Whatever it was, it helps to cope. But sometimes there's no subjective change there. You're the same person, but you're coping. That's that's perhaps the difference between CBT, for example, and psychoanalysis. There's no subjective change, because the unconscious remains the same. It's the conscious part that you're saying, okay, I have to treat myself better, or I have to be grateful for what I have. That's another thing, that, being grateful. Or DBT, that tries to be more mindful, present, in the moment. That's what they want to help the client that they have in front of them. Be present. Don't allow your mind to wander into the past, my mistakes from the past, my fears from the future. Come back to the present, where everything is fine, and you're fearful of the future, you're resentful of the past. Great. If you can do that, that's wonderful, but most people can't control that.
If I were to go to a yoga instructor,
right,
how I would judge them is that they can do all 26 or whatever, 21 moves. I assume, okay, he knows what they're doing. They are a yoga instructor. They're doing it right, hoping that they're teaching me right. But when it comes to our industry, and I wasn't going to talk about this, but it's important to cover this, is our industry. I apologize. Your industry it's not regulated.
Oh yeah, that's another problem, big problem. BC, it's not regulated. So counselor, which is a very broad word because it just means giving advice. So anyone can be a counselor, and people will not know the difference between someone who just went to a college, and in 1 year, I think it takes 1 year to get a degree in counseling. Only it's not a master's; it's just a diploma. So, and they don't have the same requirements and the same training as someone who went through a master's or a PhD. People will not know the difference. They call themselves counselors. They're not registered clinical counselors, but they're counselors because that's anybody who says I'm a counselor. It's okay.
And there's a movement in BC and I remember it was called FACT or something like that.
Yes.
If I got that right.
Right.
And the idea is that they should have a minimum, was it 1 year, 2 years? Sorry, 2 years of schooling or a master's degree before they can call themselves a counselor. Is that correct?
Well, you have to finish a master's degree. It's a 2-3 year program.
Okay.
And you have certain amount of hours that you have to do of practicums. I think it's 500. So that's a master's. And then if you go beyond that, the next step is a PhD.
And why is it important? Like for me on the outside looking at a therapist.
Because the education that you get from a master's degree, it's not going to be the same as a diploma. Diplomas are offering just a certain amount of education that you're getting. And so it's not the same. It's just not. It's like going to a doctor. Would you go to a doctor for a diagnosis, or to a nurse? That's the difference.
Well, when it came to COVID, I talked to my friends from high school that were in an art class. So they knew everything. I didn't go to a doctor. That's just a joke. That's just a joke. I went to the doctor.
Right. I mean, it doesn't, just because you go to someone who has a master's or PhD, it doesn't mean that it's going to be a right fit for you, but you have more of a chance of getting the right responsible treatment than someone who doesn't have that education. That's the difference. Yeah. It's closer to getting the right treatment, especially in dangerous situations like people who are thinking of committing suicide. So the training it's not the same.
No. And then what is the difference? So I was looking into this. There's three here. So what's the difference between a psychiatrist, psychologist, and a registered clinical counselor?
So the difference is that a psychiatrist is a medical doctor. First, they were trained as physicians to become physicians, and then they specialize. Instead of becoming anything else like a cardiologist, endocrinologist, they wanted to be a psychiatrist. And that's what they did. They specialized in psychiatry. And psychiatry usually focuses more on mental disorders like schizophrenia, psychosis. And they want to treat that, which needs treatment with medication. So they're treated. They're trained to give, like every physician is trained to give a diagnosis. They need a diagnosis so they can give a treatment with medication. Now, some psychiatrists go beyond that. They, on their own, they choose a school of thought, CBT, existentialism, whatever it is out there. There's dozens. And they go through the training to become what I am. So someone who can provide therapy. But most are not trained to provide therapy. So keep that in mind. They're just trained to give a diagnosis from a mental disorder and treat it with medication. If anyone went through the experience of seeing a psychiatrist, they'll see that. Yes, I'll see you in a couple of months. So it's not the same as seeing someone regularly and talking. That's what therapy should do, is inspire you to talk instead of acting things out, putting things in your body and acting them out in your life. learning to talk about it.
Okay, so touching on that,
Yeah.
talking about it. I'm guilty of saying at some point in my life that, well, you're just going to go talk. I mean, you can talk to anybody.
Yeah.
And I learned through my own journey sitting in front of my therapist like 4 or 5 years ago is he was listening.
Exactly.
He was
Yeah.
actively listening, and he was actually writing down notes. I thought he was drawing the entire time, but he was actually writing down notes. And after seeing him for 3.5, 4 months, it's at that point he was able to reflect on everything that I had said and look at me and just say a few things. And one of the stories was he had gone back pretty far back into my childhood, and you just actually said it as well. He went beyond that. He went to before I was born, like to the womb. That's his kind of theory. And with a very few words, he was just, he kind of looked at me and says, I want you to know you're not the victim anymore. And just to be able to say that 4 months later, and just to kind of stare at me and say that's what happens through talk therapy. We're talking through it. And I'm also guilty of saying, well, I'd rather someone go to hypnotherapy. You can go do your motivational books. You can do the chakra chanting. You can wait till Monday when Mercury's in line with the moon. And I finally came to the conclusion I understand, and I recommend talk therapy to so many of my friends is because there is a process that's actually happening. It's not just you're just sitting there and I'm just talking and that's it. It's almost I'm peeling away layers as I'm going through.
Yes. Well, first of all, it's not a social conversation.
Right.
In a social conversation, you're trying to make the other one understand what your message is. And so the other one understands your message and you get a response from the other one. What is it that you think of my message? Or are you getting my message? Am I allowing you? So it's not a social conversation. Here, you're listening to yourself. You learn to listen to yourself. It comes back to you, and there's some movement in that. Because usually we're stiff. People come with their issues because they're unflexible with something that they've been repeating all their life, and they don't know how to move from that. And so talking about it gives it a little bit of air, a movement, and allows things to shift to a different place. It's like you're putting yourself, you're a part of you takes a step back and looks at yourself and sees, oh, right, something.
I like how you just said that. Yeah. I think that's what he did. I was talking about the same thing over and over again using different words.
Right.
And as you mentioned it, there was the whatever the issue is, sometimes we have different ways of talking about that.
Mm-hmm.
But he allowed me to consistently keep talking about it, and it was layer after layer was kind of coming off till we were getting deeper and deeper to the point of that's it there.
And then, of course, the trained therapist has an ear, and depending on their school of thought, will approach that differently. And that's where you have to do your research and see what works for you, what do you want, because that's part of finding the good fit is knowing what approach you want to therapy. And the only one who can decide that is the person who wants the therapy. So depending on that training, that ear will listen to things in one way or another. So it's not the same to be a CBT kind of therapist listening to someone than to be an existential therapist, because they'll listen to things from a different perspective and but they're going to be attentive and point out the things depending on their theory, and maybe saying, oh, you just said that. Depending on their theory, they'll say it because of something that they believe. And that is what makes that difference.
And so through us telling our story, is it almost as if we're not regurgitating? What's the word I'm looking to use? We're kind of emptying everything out in a sense. Are you kind of giving us a safe place to get it all out?
Well, that's the idea, that you can feel safe. Of course, it's very important to feel safe and have that rapport with the therapist, that you feel that person there in front of you has something that will help you, it doesn't matter if it's true or not. If you believe that the other person has the know-how that will help you, that in medicine it's the same thing. You go to a doctor, and part of what is helping that individual is thinking, oh, this doctor knows what I have and will give me a solution to it.
Yeah, that's
it's very common that you have hypertension, and when you see the doctor, they measure it, and it's fine now because now you're in good hands, so your tension comes down. It works that way. It's kind of a placebo kind of effect that anything can have when you're in front of a professional that you believe in.
I think I brought this up with you before. I talked about making the decision to deal with our trauma, say coming to a therapist, psychologist, and so on, but also not wanting to live there.
Yeah, that's a very important point, because that's what you want the patient, the client, to be, is free. You want to give them freedom of choosing on their own. They're not free. People, when they come to therapy, is because they're attached to so many things that are torturing them, that don't allow them to make their own choices. And perhaps a little bit is, maybe I want to explain a little bit my approach to self-hate and what it means, where it's coming from my perspective. It's a Freudian approach, a classical Freudian approach. And psychoanalysis also has different schools of thoughts, so depending on who you follow. But from a traditional Freudian perspective, the mind is divided. It's divided in, or he divided the mind in it, which is the instincts, that instinctual part of that wants us things. It could be anything, it could be even wanting food, wanting sex. And he divides those instincts in two perspectives, two roots. And one is he called it the eros from erotic, that part of ourselves that wants life. That's what it is, an instinct to life. And then the other part, which he called it thanatos, or death. And then thanatos, I think I'm pronouncing that right, thanatos, which is a god of death in Greek mythology. And so you have that instinct, which is the id, and then and it's run under the pleasure principle. So a baby, for example, is 100% id, 100% instinct. That the only thing they're thinking is, give me food. I want food. They're not thinking, why is it? Is it what kind of food? What they just want food, and you have sort of demanding to satisfy that pleasure principle. Then you have the ego, which is not the same ego as the popular belief. Ego as we're too egocentric, or it's a different kind of ego. Ego is also called the I. It's the me. It's the organized, realistic part of our psychic. It's the one that is more realistic. It's the one that is in contact with the outside world and has to make decisions, and goes through the reality principle. That's what he called it, the reality principle. It's the one that most therapists focus more on the ego, the reality, or the one that makes decisions. And then we have the other part, which is the superego, or above I, which is well described because it's something that has to do with the critical or moralizing function of our psychic. It's it incorporates the values and the morals of society that we learn from our parents, our caregivers. Yeah. They incorporate those moral values, and that is the superego, is the one that tortures people when those demands are too high. They bring guilt. And he actually divided the superego in a part of the ourselves that is the moral side and the ideal self. So the ideal self is the image that we have of ourselves that we want, and sometimes it goes above of what we perceive ourselves to be. So we're saying we should be more than who we are. We should achieve these. And that's when it's never, you have this
Never ending.
ideal, and never enough, because you have this ideal image, which is a lot of times even perfection. And it's unachievable. That's why it's never enough, because you want to be this image that you have of yourself, this ideal self, that's unreachable.
Because we're not satisfied with what we have, and we keep. I mean, society itself tells us more and more, and
well, yeah, because it's
look like this, be like that.
Well, it's you have to think that we internalize at some point the first years. Actually, the superego comes into place when around age 4 or 5. In the beginning, nobody is. Babies are not thinking it's wrong to do this. I shouldn't be doing. Little children. That's why they do things that with no issues, no problem. It's the parents that put those limits.
Have you had to deal with the effects of social media on your patients? Like, I'm trying to parallel that with what you were just talking about of the pressures of having to be like this, having to be like that. It's not enough. And we already had that, I'm sure, in the 70s, 80s, and 90s,
Right.
2000s. And then social media comes along.
Right.
And now it's hitting these kids really early.
Yeah.
And now they're not just comparing themselves to the kid at school. Now it's thousands of kids.
Right. I think that what happens is issues that humans have always had to go through, mental health issues, are being expressed differently depending on the culture and the historical moment. So in the 1500s, people would be being accused of being witches.
And they would burn them.
And they would burn them.
What was it? How did it work? If the woman didn't fly?
Yeah, I don't know. Whatever it was, but you would see mass hysteria.
Yeah.
So people who would say, I'm being possessed by a witch. And everybody would, especially you would see it in teenagers and especially in girls, that they would just be thinking that I'm being possessed by something, and they would show all the symptoms. And so they were using their issues, but adapted to the culture of that time. Then in the, in Victorian era, when, sex was so repressed and women were allowed to do so many things and only men could do them. Not that it has changed that much, but at least it's a little better now. And so that's how Freud came into the picture, because he would see all these women with all these issues. They were having psychosomatic symptoms, paralysis that were coming from, it wasn't, they could not find anything that was physical. And most doctors would make fun of that. They would not take it serious. But Freud was one of the first that was interested in that and saying, well, wait a minute, there's something, they're not making this up. They really are having a paralysis, only they believe it. They're putting into their body what they can't be, what is being repressed. Usually it was sexually repressed because they weren't allowed to have a sexuality in those days. And so he was seeing all these patients, and that was an expression of those times. We don't see that kind of patients anymore because we don't have that, maybe at least not in this part of the world, we don't have that repression. But we have other issues like you're mentioning, social media.
There's a conversation that we have internally before we contact you. It might be I'm at home and I'm feeling the things I'm feeling. And there's a process that we take I'm assuming that before you get the phone call, your patient is at home thinking like, I'm not feeling well, or they're saying to themselves, could you touch on what do you think some of those I know you don't know, but what can you assume some of those conversations are? Because the idea of the podcast and the method is ways that we can help, right? Now we've covered it that this is not one of those things where the method is going to be a 5-step method or a 2-step method. The method here is for them to contact a professional.
Yeah.
But prior to contacting that professional, there is a internal dialogue they're having.
Right.
What does that internal dialogue possibly sound like that might encourage them to say, listen, if these are the thoughts you're having and these are the things you're saying and feeling, possibly you could be going in this direction to get help?
Well, first of all, the same way if you have physical symptoms and you immediately don't think it twice, you go to a doctor. If you think I'm suffering, I'm not enjoying my life, something has been like this for a very long time, just doesn't go away. Whatever it is, you're suffering. And then you have to tell yourself, I can't do this alone. I need help. And it's not going to be friends. It's not going to be family, because they can give you advice. They can tell you what things they would want you to do because that's what they would do. But it might not fit what you need. So think about asking for help. And there's different ways to get that help. If you don't have the financial means, there's a lot of nonprofit organizations. Look for them. Just Google it. And look, in that case, you don't have many options because it's more limited. If it's a nonprofit organization, they will offer whatever they have available. Usually it's CBT, because one of the things that you have to keep in mind is that, and that's why CBT became so popular, because it's short. And that's what the influence of the insurance companies came into place. They don't want long therapies because they don't want to pay that long. So they want something short and sweet, something where you come, I say, I have a problem. What's your goal? Okay, let's find a solution. So in a few sessions, you're supposed to be good to go. And if you don't have the financial means, unfortunately, the government, unless you go to a psychiatrist, which we are already explaining what happens, the limitations with that. It's okay to go to a psychiatrist. Just if you don't want medication, just tell your psychiatrist, I'm here to talk. Most likely he's going to say, well, we're not going to talk. I'm going to give you medication. And so that's going to be a limitation. Some don't. Some say, some are trained, or some say, sure, come and talk. But then look for a nonprofit organization if you don't have the means. But if you do have the means, see it as an investment in yourself. If you can pay for it, and be honest. Sometimes you're paying for so many things that you think are that I don't know, video games, things that are not that important. But you think that paying a therapist it's a waste of money. Well, it's not. You're investing on yourself. Even if you don't have a huge problem, you don't have to have a huge problem. It's something. It's a way to see life from a different perspective. It allows you to mature. It allows you to take responsibility, a little bit more responsibility about your life. That you have choices. You think you don't, but you do.
I wanted to end this on this, and I remember we've talked, and I should actually let people know I know you from my actual boxing class, my boxer fit class, and I never got a chance to speak to you for years, and then when I found out, I told you I was doing this. That's why I wanted to kind of have you on. If you could recommend a book.
A book?
Yeah. To our
listeners.
Or a few.
No, well, I like reading. It's something that I enjoy. So there's novels, there's so many things, but it's going to be my personal choice. But if I have to recommend something, I remember once you asking me, what would you recommend if you have to recommend? I think you were asking more for a personal, a self-help book.
Yeah. And I'm so guilty of that. I'm guilty. Yeah.
No, that's okay. That's okay, because it's very common that we think this individual is into this profession and I can get the answers. That's the other thing. We are all the experts in our own life. Nobody. It doesn't matter how many degrees you have. Nobody will know more about yourself than yourself. The therapist is just there to allow you to bring those things to the surface and find your inner strength, if you want to say, but doesn't know anything more than you know about yourself. A book that I would recommend that I love, I read it quite a few times because I just love it. It's a marvelous book. It's by an American Chinese author who died many, many years ago, so maybe most people don't know too much about him. He was a novelist, but he wrote this wonderful book called The Art of Living. And what he says in his book is he writes about that everything can be an art form. So he talks about making tea. It can be an art form of even being lazy. The art form of being lazy. So that's
you shouldn't have said that. There's a lot. Positive people are listening to this thing. Oh, okay, I'm good at that.
Okay, and that's great. That's great that you can be. But that's the other problem. Many people feel guilty about being lazy in this society because we have that pressure. The money. We have to make money. We have to succeed. Well, no, we can also be lazy. Why not? And this book talks about, so many pages about the art of being lazy.
Gabriel, on that note, I appreciate everything you shared with us, and I would like to kind of have you back and we can discuss and go deeper down this road. Thank you.
My pleasure. Thank you for having me here.